Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
Welcome back to the Southern 7 podcast. I'm Shawnna Ryan. Joining me today are two ladies who have been with us for quite a while now. They are coming to us from the Center for Asian Health Equity out of Chicago. We have Madeline Bernard and Passang Gonrong. Ladies, did I pronounce your names right?
Absolutely.
Okay, that's always my biggest concern. We can move on. Okay. Now, one of the reasons that we are here today is we do have an event coming up in March. It's on the 25th at Ferncliff State Park from 9 to noon. It's our annual Strollin through the colon, except this time we're going to be doing things a little bit different. We are going to be adding a hike for a cure to this event. So when you come out, you're going to have an opportunity to walk through a 20-foot inflatable colon. I kid you not. Get all kinds of prizes, and then, off on your own on whatever trails you want to go. We're also going to have our WOW van there that day. If you're still needing some vaccinations, some medication disposal packets, Narcan training, fit kits, whatever you want. So a great all-around day for you and your family. We do encourage you to bring the dog. Bring the dog. Dogs love Ferncliff State Park. So make sure you bring your furry friend out there with you that day as well. But ladies, thanks again for joining me today. I do appreciate it. Again, you've been part of this effort with us for a little while now, but the Strollin through the colon is not possible without our fecal immunochemical test kit program. Tell us about that. But before we go into that, tell us who you are and what you do at the center.
Hey y'all, so I'm Madeline. I'm one of the program managers on the cancer prevention team here at the Center for Asian Health Equity at UChicago Medicine, alongside Passang, our other program manager on our team. And our cancer prevention program aims to increase cancer screening across the state of Illinois. Specifically, our hallmark program of CARES really focuses on CRC screening in uninsured, underinsured, and underserved populations. We started back with Southern 7 specifically in 2018, way back during our Cook County CARES program, and then carried through with our Illinois CARES program. And the center has really always focused on a statewide kind of approach. We launched in the urban area first in 2015, but we always intended to move south, where the CRC kind of hotspot is. So partnering with Southern 7, we've really expanded our CRC screening efforts and reaching a whole new community.
Exactly. And Passang, tell us about yourself.
Yeah, thanks, Shawnna. Thanks for having us on. I'm Passang, the other program manager working on the cancer prevention team, working alongside Maddie as well with Southern 7 Health Department, and then also our other partners through CARES.
Very good. Well, again, ladies, thank you so much. And thank you, Maddie, for explaining the program and the purpose of it and its reach down into our region. Like you say, we've been doing this since 2018 and have helped a lot of people throughout the region to get those first steps in colorectal cancer care. As far as expanding it down into our region, you kind of touched on that a little bit in terms of us being in a hot spot. Can you elaborate on that a little bit for us?
Yeah, absolutely. So as a whole, Illinois ranks in the last quartile for CRC screening rates. So CRC is really a statewide issue, and in the last quartile for CRC death rates specifically. But one of the kind of CDC designated hotspots is down in Southern Illinois. So this is specifically a really high risk population, whether that be through underserved population. So they may be, a higher population of those who are under or uninsured and not able to, access the care that they need, specifically preventative screening. And like we always say, screening saves lives. So this population may not be able to access that screening, whether it's, structural barriers, geographical barriers, lots of things. So our program really aims to address those barriers to specifically reach that hotspot community.
And then also just to add, I think Southern Illinois is one of the only 3 hotspots in the United States. So we're really we're really excited to partner with Southern Illinois as well, just to reduce that burden and increase screening rates.
Exactly. And we do see in our region a high rate of cancers across the board, not just colorectal cancer. But like you said, there's many reasons for it, but this region sits in what I call a health desert. The majority of the people that live here have to travel sometimes 20, 30, 40 miles just to get basic advanced health care. But to get colonoscopies is a whole other issue. And so it's good that we've got this program here. Tell us about the FIT program and how that benefits residents. Song, we'll let you take the lead.
Yeah, I think the FIT program is really, really impactful in Southern Illinois, especially. We know colonoscopies are a lot of work, especially for patients. They have to take a day off, they have to have transportation, they usually have to have someone with them. So these FIT kits are really amazing that you can just kind of do them on the spot and then just send them or drop them off at the health department, which I think is it's so impactful, and it reduces that burden of transportation, of time, of taking a day off from work. So we started the FIT kits, like Maddie mentioned, in 2018, and also Southern Illinois, you all have been doing flu fits, so kind of combining both getting their flu vaccinations and also getting a FIT kit. So I think those FIT kits have been really impactful. They're free for the patients too as well. So especially compared to Cologuard or other screening types, it's super inexpensive and very easy.
Now, what does the FIT kit specifically look for? I mean, you mentioned Cologuard. Cologuard is a DNA test. What is the FIT test? What does it look for?
So I believe it's looking for the presence of, it's a stool-based test. It's looking for the presence of any blood in the stool that would indicate polyps in the colon. So a possible abnormal FIT test would lead us to recommend the patient be fully screened through colonoscopy, which is the sort of gold standard. So when they take a FIT test, like Passang had said, it addresses about 1 million barriers that we're trying to overcome in any community, but specifically the Southern community. Those are recommended to be done once a year. Whereas a colonoscopy, the gold standard is once every 10 years. So if you have a clear FIT test 1 year, you are recommended to test again the following year. But if there is an abnormal FIT test, it is recommended that you follow through with that colonoscopy.
Exactly. And as far as the FIT test itself goes, like you said, it's completely free. We don't bill patients' insurance for that here at Southern 7. If you want a kit, you get a kit. Now, there are some limitations on it. We generally want people to be between the ages of 45 and 75. We want them to, if not, to have, maybe an immediate family member, something to determine whether or not this test is right for them. Now, one of the questions that we ask people when they request a kit is, are you currently having a health condition that warrants you seeing a doctor, maybe going ahead and going for that colonoscopy? And I'll just come right out and ask them, are you having a bleeding issue? Is your doctor thinking that this is not the best treatment for you at this time? If that's the case, then we go ahead and we defer them onto their doctor. But for the majority of people, it is a good starting point. And it's not to replace a colonoscopy, right?
No, it just gets it gets people a lot closer. And I think, especially with preventative screening and specifically colorectal cancer, there might be a lot of stigma, or just, people are, oh, I don't want to take that test. It's gross. It's a lot of hassle. And it's more like, this FIT test is so easy. Here's the first step to even starting a conversation about it. And starting, opening that door, whether it be with your local health department or with a provider that you get connected with, just about future screening too. So yeah, it's just the first step, really.
Yeah, it is. It's great. We get a lot of people that will call for a spouse who's hesitant about getting that first colonoscopy. It kind of opens that door to them a little bit because they see it's really easy. There's no prep involved in it. They don't have to have a doctor's referral for it. And there's no dietary restrictions. A lot of people like that as well. Now, in our region, majority of the doctors in our region are already aware of the FIT kit. They have referred patients to us in order to get that kit. So we don't want people to think, okay, this is a new thing and they don't know much about it. And, you know, this has been around for a while. Fit has been around for quite a few years and doctors are aware of it. So it is a really good starting point for people. Now, as far as partnerships, we have partnerships with other agencies in our region that recognize this. Tell us a little bit more about that.
Other agencies that we've partnered with, other health systems?
For example, we partner with Chessie. Yeah.
Yeah, absolutely. So we've worked in the southern region specifically, like you said, you work very closely with Chessie. I know we've partnered through our kind of Southern Alliance because you do work with very similar populations, and that's another big goal I think for our program and for Passang and I you know, our job specifically is creating that network between, you know, public health departments and clinics in Southern Illinois because there are, you know, strength in numbers, and in such a place like you mentioned, the healthcare desert, so to speak, it's really important, you know, that everyone there is connected, working towards similar goals and that. So yeah, we've worked on like I mentioned before, our CARES program with Chessie, and then we're also beginning work with Passang Memorial Hospital. We've also partnered in the past and are working on bringing them up to speed Union County Hospital for taking referrals so that, you know, in the case of positive fits, we have those locations ready for colonoscopy referrals in order to expedite patients getting through and helping them getting, you know, complete their screenings.
Well, and also for patients who might be uninsured or don't have the means to pay for a colonoscopy, those partnerships help with that as well, right?
Definitely, yes, especially the partnership with Union County Hospital, where patients who do receive a positive fit can get a free colonoscopy through the CARES program, where they can go to Union County and get that colonoscopy and also have a free overnight stay as well.
Yeah, because I mean that night before is always kind of rough. I often say I wish we could do colonoscopies in the middle of the night instead of like early the next morning. Yeah, we need to work on that. But yeah, it's good to have those partnerships in there because, you know, for a patient, oftentimes they don't want to complete the fit kit because their biggest thing is, what if it's positive? What do I do next? And we're there to kind of help them with those first initial steps and what they can do from there. So that's what's so great about the partnerships that we have there.
That is a really big focus. You literally just let in of our program, as well as that linkage to care, right? We don't want to, and that's been a huge thing. I feel like with Southern 7, you do such amazing job with outreach and, you know, connecting the patients. You don't just, oh, we don't have the answer for that right now, we're going to leave you hanging. It's you all really work to the end, and that's a goal of ours as well, is linking those patients to the care that they need.
Exactly. And we have, you know, our nurse here at Southern 7, she's ready and willing to answer any questions that you might have. If your test comes back positive, she will be the one to contact you and help you through that process. And again, if your test is fine, there is no presence of blood in your stool, you'll just get a letter and be referred back for the next year. So the process is very simple. That we do everything we can to help you through that process and get patients exactly what they need. Is there anything else you'd like to share today, ladies?
No, I think just thank you, Shawnna, for all of the work that you do. I think you're the force that makes all of this happen.
The champions, we like to say. But no, we're really excited for your event as well. She was not kidding about the inflatable colon either. We are shipping that all the way from Chicago, so it's going to be a sight to see, and I think it's going to be an amazing day. Great prizes. We've worked with everyone at Southern 7 and Rudy over at Hope Light, and it's going to be a great day.
We're going to have lots of fun. Yeah, there's going to be people there from Chessie, from Rural Health, it's going to be there. So yeah, it's going to be a really good day. And like I said, we're going to have our WOW van out there, which is our Wellness on Wheels van. And you can get your COVID booster if you need it. You can get Narcan training if you need it. A lot of services are available on that van as well. But again, about the event, once again, it's going to be March 25th from 9 to noon at Ferncliff State Park. We're going to be in the Hillside Shelter. And if it should rain, which we're really very hopeful that it won't, we are going to reschedule for April 1st, same time, same location. So we are planning to have this event come rain or shine, either way. But yeah, go ahead and come on out. There's no pre-registration for it. You don't need to do anything other than just show up and be ready for a good time. So the whole process itself, if you want to hang around with us, maybe takes an hour, takes just, maybe 20 minutes or so to go through the colon and talk with our healthcare professionals. You guys are going to be there too, right?
Absolutely. Oh yeah, we'll be there.
Very good. Okay, so it should be a fun day. We are telling everybody, please, tell your friends to come out. The city of Goreville is 110% behind this effort and are helping us get the message out to residents. So we're very grateful to them and all of their help in this as well. Now, folks, if you'd like to get your own fit kit, if you've never had one before, you can give us a call here at Southern 7 at 618-634-2297. That's 634-2297. You can also request one on our website at southern7.org. So you can request that. Once we get your request, I'll give you a call just to see if you need anything or have any other questions. Explain to you how the kit works and what you need to do. But it's very simple. It's very, very easy to complete. No big deal there at all. All right, ladies, thanks so much. Do you have anything else you'd like to add?
No, thanks so much for having us. It was great.
Yeah. Well, it's wonderful working with you all every day. You put up with my goofiness on an almost daily basis, which I appreciate very, very much.
We appreciate the energy.
It seems like there's always something. So thank you so much for all your help. I appreciate it.
Thank you.
Thanks, Shawnna.
All right, we'll see you on the 25th, ladies.
All right, see you soon.
Yeah.
Bye-bye. Okay, well, that wraps up another episode of the Southern 7 podcast. Thanks for joining us today. Once again, if you'd like more information about FIT, just give us a call here. That number again is 618-634-2297. That's 634-2297. You can also download the Southern 7 app, which will take you directly to our website, or you can go to southern7.org and request your kit very, very easily. Well, thanks again for listening, folks, from all of us here at Southern 7 Health Department. Have a great afternoon.